Health specialist Leah Sarich joining us right now. A lot of people suffer from frequent headaches in our city, right? Are they migraines, tension headaches, sinus pain? Well, Leah is you're going to dispel some myths regarding sinus headaches.
I am. Because what often happens that people who think they have sinus headaches actually do not.
Okay.
They actually have something else. Just maybe a tension headache. So they've got referred pain coming from the shoulders or the neck or the jaw. That's a big one.
Oh, from like clenching and stuff?
Exactly,
Okay,
yeah. So that's a big one. Or maybe they've got some other kind of headache. Maybe it's just a migraine, right? So this is what we are talking about. So I spoke with ear, nose, and throat surgeon Dr. Brad Mecker about this, and he tells us exactly what a sinus headache is.
The vast majority of people presenting with a quote-unquote sinus headache are experiencing either a muscle tension or migraine headache. A true sinus headache, by definition, comes with the onset of a cold or a sinus infection and goes away once the infection is gone. And it's usually pain in the forehead or in the cheeks, most likely the cheeks, and will go away when the patients get better.
There you go.
There you
pain in
go.
the forehead and the cheeks.
Yes, and with a sinus infection or a cold.
Yeah,
that's the real
and that
key.
makes sense because that's where the sinus cavities are, right?
Exactly,
okay,
exactly. And it should go away when they get better. That's the trick. But in fact, studies show 90% of people who see a doctor for a sinus headache do in fact have a migraine or the referred pain that we've been talking about. So then what's happening is that people have these sinus headaches, then they start treating themselves for what they think is a sinus headache. So they end up taking those cold and sinus medications.
Sure.
But we have to be very careful with those medications, and Dr. Mecker explains why.
If somebody's on a decongestant, we typically don't want to use it for more than about 3 to 5 days at the most. People can develop what are called medication-dependent headaches, where if they're on a analgesic medication for an extended period of time, over 2 to 3 weeks, they will become dependent on that medication. They'll need it to feel better, and help themselves breathe better, because they will get rebound congestion, as well they become dependent on the analgesic part of the medication.
I didn't know you can become dependent on that stuff.
Exactly. So you get the headaches because you become dependent
like
on
a
the
hangover.
medication. Yes, exactly. So you have to be really careful with those medications. So if in fact you do have a sinus headache, and we've established that's in fact exactly what's going on, Dr. Mecker recommends quite a few lifestyle changes that you can do.
Oh, wow.
So the number one thing is make sure you're sleeping properly. Because if you're not sleeping well, you're not going to feel well. And he said also it's boosting your immune system, of course, so you can fight off colds and flus better. So number one, make sure you're sleeping well. He also said make sure you don't have arthritis in the upper part of your neck, because that can be causing that referred pain that we've been talking about. See a dentist that's trained in TMJ, that's the jaw disorder, right? Yes, yes. So make sure you see a dentist that specializes in that and find out if that's what's happening. He also said maybe consider doing some acupuncture. He said acupuncture is really great for sinus headaches. In fact, Dr. Mecker refers 90% of his patients with sinus headaches for acupuncture.
Really?
Yes, 90%. Yes. So he says it's a very effective treatment for sinus headaches.
What about Chinooks?
Oh, what about Chinooks, of course.
This is Calgary. Everyone talks about, oh, there's a Chinook coming, I got a headache.
Exactly. So this is a big, big deal. And we certainly know there is, in fact, a link between Chinooks and headaches. We know that exists. We've done the studies right here in Calgary. But in terms of sinus headaches and Chinooks, not so much. They have actually done a study here in Calgary. They took 50 people that have Chinook headaches and 50 people that do not have Chinook headaches. What they did is they actually CT'd their sinuses, and those with the Chinook headaches actually had clearer sinuses.
Than people without.
Exactly.
Okay,
exactly.
so there's no connection
no
between
connection.
those Chinook headaches and
a sinus headache.
headaches.
But what it is probably is a migraine.
Likely a migraine.
Yes,
There you
there
go.
you
Good
go.
stuff. All this information will be on Leah's blog.
On my blog, you bet.
breakfasttelevision.ca. Lots of good information on our website. Speaking of information,